Matt Delvecchio here on a gorgeous Sunday. Thanks for tuning in. As our population ages, care needs increase, and we're clearly seeing that our existing healthcare system is not able to effectively manage these escalating needs. Is it time for a mixed healthcare system? Should we be increasing private sector assets to support the public sector, similar to systems in France and Sweden? A lot of pros of that, a lot of cons of that. Well, we have the editor of the Suburban, Beryl Wajsman, in studio with me to debate this hot topic. Beryl, welcome back to Life Unrehearsed.
It's a pleasure, Matt.
Great to have you in studio. Just before we get into this healthcare crisis, Beryl, I want to congratulate you and the team at the Suburban. Fantastic publication this most recent week. Nice senior section. Lots of advocating for seniors and healthcare. So great edition. Really encourage our listeners to check out this week's edition of the Suburban. Now, you're all fired up about healthcare. We're going to get into this right away. It's extremely fragile. Love to get your opinion on the status from your perspective of healthcare today, and then we're going to start asking you for some solutions. So today, what are you hearing from the street?
I'm going to flip this around from our previous conversation. I'm going to take your lead. So let's go back. Let's start with what's in the paper. So we have an article in the senior section, the loneliness of seniors, and how that's a critical issue in mental health and physical health and everything else. Why are they lonely? There's something called orphan seniors. It's a sociological term. It was developed in the Depression for Oklahoma, which not only had a depression, it had a drought. So 60% of people over 65 who had children didn't have them with them. Songs like I'm an Okie from Muskogee, novels like The Grapes of Wrath. It was a whole cultural thing. Now, today's 65 is not yesterday's 65. Today's 65 is yesterday's 45 or 55. But this number of 60% orphan seniors had not been seen in North America till Montreal about 20 years ago, when the non-Francophone population started seeing their children leave. So in the non-Francophone population, and Montreal is 50.3% non-Francophone de souche, it's 45 to 55% depending on which culture group. Yes, there's no money for enough services. We'll get to that in 15 seconds. I'm timing myself. Excuse me. The biggest problem, seniors don't have children here. Matt, there isn't a week that goes by that I don't get a call from somebody, either somebody I know or somebody got my number or figures I'm a fixer, I know everything, from New York, from Toronto, from Miami. Could you call my parents and do this? And these are rich folks. These are professionals, financial guys. And my question, you're telling me you left and with all your money, you didn't provide a healthcare regime, a caregiver regime for your parents? So just home caregiving, which the hospitals are trying to do. The Jewish General is leading in this, but every hospital has a home care thing. Not enough personnel.
Yeah, not enough personnel waiting. In fact, on the second half of Life Unrehearsed, we're going to be addressing the waiting times at CLSCs. Over 20,000 people waiting for home care. And I think you were mentioning off air, Beryl, I think a big part of it, if you can throw some stats out there, I'm blown away about how much bureaucracy is in our healthcare system.
That brings us back to the political side of the equation. You had asked me last week when you suggested I come on to talk about healthcare, my opinion about it. Well, the opinion is not an opinion, it's a fact. Every reform has been a disaster. Bill 15 will result in more centralization, less community input, and more deaths. And as one MNA put it to me, we're not going to have any real redemptive change until we see 10,000 more people die and people marching with torches in the assembly. Why? Because Medicare doesn't work, particularly as it is in Canada, particularly not in Quebec, and for the following reason. I'll try to make this brief. The Pearson Medicare plan was a very simple, needed, compassionate plan. We're going to deduct money from your paycheck. No family that faces medical trauma will have to suffer. It's like unemployment insurance. We're not getting involved in medicine. We're not getting involved in your hospitals. Then 68, 69, 70, 71, the premiers started to see Saskatchewan. Now, Saskatchewan had nationalized the medical profession in 1956 under Tommy Douglas, the first and only socialist government in North America. They nationalized it. It was an 11-month doctor strike. It wasn't the same. but they wanted the powers that Saskatchewan had, the powers over the hospitals, the powers over how much money to give to the hospitals, the powers to decide how much medicine to give to people by age. An hour to a day is spent by doctors in every hospital filling out what are called Grey Card protocols, reporting back to Health Quebec how much medicine they've given to whom, by age, and why. So we find ourselves today in a situation where 40 cents of every tax dollar we pay to Quebec goes for health care. That's absurd, and doubly absurd when you consider that 52 cents out of those dollars go to pay bureaucrats who have no relationship to the delivery of medical care. And when I say no relationship, I'm talking from the street cleaners in the hospitals to the radiologists, who, by the way, are the highest paid profession. None. They're bureaucratized and they're unionized. And there hasn't been a government that's willing to take the grand risk that France did in '98 and cut the legs from under them.
Listening to Life Unrehearsed, that's Beryl Wajsman, editor-in-chief of the Suburban newspaper. We're talking about the healthcare crisis. You bring up such an important point. Going to put you on the spot here, Beryl. Unbelievable number, 42 cents or whatever that is, of every dollar going to bureaucrats in the healthcare component.
52 cents 52 of every dollar spent in the système de soins santé is going to pay bureaucrats.
All right. So what do we do, Beryl?
Well, the ideal solution is for, remember what Einstein said? Anybody who repeats the same thing and expects a different result is insane. That's what governments keep doing. They keep getting more power unto themselves. This cannot end well. This will not end well. Government, particularly in Quebec. Why particularly in Quebec, I say? One thing I'll give Legault. He has, as you mentioned earlier, he has turned more to private sector solutions, and we need them. But until governments say, we're not being involved in decision-making anymore, we're not going to hold you on the throat. But it's hard in Quebec because Quebec is a particular jurisdiction in the Western industrial nations. We are the only jurisdiction where 1 out of 4, roughly, people work for directly or indirectly for the government, crown agencies or ministries, and they are all unionized. So this is about votes. You attack the system. You do what France did in 98, 99, declare a state of emergency, cut the power of the unions, slash the bureaucracy from 56% to 37%, where it stands today, return some of the money to the hospitals, give doctors the right to clinique privée 15% of the time to give to the public system. You're going to have a political issue here in Quebec. Chirac had it, but it wasn't as grievous as it would be in Quebec. So I'm not optimistic, and it's a crapshoot.
That's Beryl Wajsman from the Suburban. Tough decisions that will have to be made. It just simply can't go on like this anymore, Beryl. We're already out of time. We could talk the whole show about this, Absolutely. Beryl. I know you could. Just a shout out to the Suburban. And I also have to say, I know that they're getting a lot of traction with the best of the Suburban. So really great job. You're doing fantastic work. Quick stat that you were sharing with me about the numbers of the Suburban.
Well, we without going into specifics, we are the newspaper with the second greatest number of readers in Quebec after the Journal de Montréal, which is, pretty special.
Fantastic, considered all.
And yes, the best of Montreal. Our sales team is incredible, and they've done a marvelous job with it. It's become really something people are asking about.
Well, great stuff, Beryl. Wishing you continued success, and really, I wish you would keep your thoughts to yourself a little more often.
You think I should? Yeah, I'll look for the medium way. As it's burning, the whole house is burning around us, sure.
All right, this Beryl Wajsman, editor-in-chief of the Suburban newspaper. Always a great interview with Beryl. Thank you very much.